Another brilliant opportunity to discourse on COVID-19, and today finds us in the embassy of Israel in Ghana, and we're going to be having a discussion with Ayelet Levin Karp, who is head of the Trade and Economic Mission here, but she also happens to be a biologist. She has a master's in synthetic or microbiology from the Weizmann Institute, renowned for biological studies, and that is why we find ourselves here to tap into what exactly Israel has been doing in respect of the coronavirus, and more importantly, what we can learn from that. Ayelet, thank you very much for having us.
Thank you for coming.
Your name, Ayelet, what does it mean anyway in Hebrew?
Ayelet means sunrise, actually, and I learned.
Sunrise.
Yes.
Beautiful.
I learned it's also similar to a Ga name that is available, Ayele. Is that correct?
Oh, okay, Ayele. Right.
But it's Ayelet.
Ayelet. Right. So you have a lot of people calling you Ayele from time to time.
Yeah, and they're surprised when they see me afterwards. They realize I'm not Ga.
Right. So let's talk briefly about your background in biology. You're a biologist.
Yes, that was my past career, I would say. But yes, I have a bachelor's and master's in biology. I worked in a few labs until I decided that I want to do more and left it to the civil servants. Actually, funny, because my last position that I was offered was to do research on some virus that attracts chicken in Israel and was causing the farmers some trouble, which was the coronavirus. It seemed to me very esoteric and not a very interesting topic to research, so I declined, which is now seems to be more relevant than I thought.
Right. So let's talk Israel, and the reason, part of why we're here, is because of the sort of strides Israel has made in terms of developing a vaccine, in terms of vaccinating, its population. Basically, you're leading the world in many respects. But let's start from the status quo when it comes to Israel and dealing with COVID-19. What are the numbers like?
Yeah, so Israel was hit quite hardly by COVID. We have about 700,000 cases of COVID that were discovered in Israel throughout the year. Over 5,500 deaths, and 3 lockdowns. Currently, as we speak, the airports are locked and the borders are closed. And it has been a not easy year in Israel, like in a lot of other places in the world. But we are, like you mentioned, also seeing maybe the light at the end of the tunnel, since we are very advanced in our vaccination program. So it's important to note Israel is a roughly 9 million people country. It's quite a small state, and we were able to vaccinate, at least for the first shot, 4 million people, which is almost half of the population. And the second shot of fully vaccinated, we have up to 2.6 million people, which is way far ahead from the rest of the world percentage-wise.
So that's exactly what I was about to get to, that unique position Israel finds itself in, because right now, the last time I checked, you had vaccinated upwards of 3 million people. So you just mentioned 4 million people, and that's just about maybe 45% of your population. That is unique. How has Israel managed this? How have you managed to do this?
So Israel is very uniquely positioned. Being a small country, like I mentioned, we have quite a diverse population. From Israelis, basically kind of like a microcosmos of the world. We came from all over the world, and we have a lot of different ethnicities and a large variety of ages and so on. And having a very strong health system. We have a very completely digitalized. So there's a lot of data records of the entire population, and also quite a strong point of care system that we have centers, and every Israeli citizen has access to efficient healthcare services. This position was very attractive to Pfizer, one of the developers of the vaccinations, and there was an agreement that was set between Pfizer and the State of Israel that Pfizer will prioritize vaccinations to Israel, and in return, Israel will conduct basically a big test and will share all of the information of the results of the testing with Pfizer and actually with the entire world.
Because I know that's one of the things Israel has done effectively across the world. You've been one of those in terms of the research into COVID-19, the testing, the human testing and all of that. You've been at the forefront. And so you're saying that is part of why you're getting, the concessions you are from Pfizer.
So the main reason was that the clinical trials are done and we know that the vaccination is safe, but it was never, in order to go to the next level and test it on a very wide population, you need a place that has this, the ability to manage these kinds of data. Israel has these abilities both from the technological perspective and also just the way their medical records are organized in Israel is quite easy to work with and access. And that was one of the biggest promises of the interest that Pfizer has in prioritizing Israel like that. And we see that actually just a few days ago, the first elaborate study was released through our biggest national health insurance company, Clalit, which showed the study was done over 1.2 million people. 600,000 of them were vaccinated completely, already past the 2 vaccinations and 7 days after, and 600,000 that were not. The study compared one by one, so everyone that was vaccinated got a similar patient with a similar medical record that was not vaccinated, and they were able to show that the vaccination was able to prevent getting the disease in 92% and 94% in getting the severe case. And these are very, very promising and encouraging outcomes of this research, which are similar to what we saw, what Pfizer was recorded on the clinical trial, which was 95% of prevention. And this is new data that is coming out of Israel from this.
Tell me, Ayelet, in Israel, do you have any restrictions on who can get the vaccine? I mean, here, for example, children of a certain age, pregnant women, people with HIV, some people are excluded for certain reasons. What's the picture like in Israel?
So, of course, in Israel, there was a priority line. So we started from the elderly, started from the healthcare providers and teachers, and then went to, quite quickly moved on to the elderly and going down by age. Nowadays, everybody that is over 16 is eligible to get the vaccination because we already vaccinated a very high percentage of the elderly population. Pregnant women are actually very encouraged to take the vaccination, since even though it wasn't clinically tried on a pregnant woman, we see now with the new strains, the new mutations, which I didn't mention, of course, that we know across the world, and also Israel has these new mutations, we see that they affect pregnant women quite badly. So there's actually a special drive to vaccinate pregnant women specifically. So it's only children that are now left under 16 we don't vaccinate yet. They also usually don't get the disease in its severe case, even though also that we see now since we are vaccinating the other populations, and with the new mutations, we see actually a very worrying trend of more kids that are getting severe sick. So we'll see, and there's a drive to try to make the vaccinations safe also for children.
Right. And at least that points to me, since you're mentioning below 16, in Ghana, below 18 is a child, so that means in Israel it's below 16.
For now, as far as the vaccinations, it's below 16.
It's below 16. Let's talk, is Israel trying to achieve herd immunity? And this is just a build up on some of the things we have said. Herd immunity, so that, if you're targeting a specific percentage of your population, and after that, hopefully, there'll be enough people in the system who can't acquire the virus or pass it on. Is that a plan?
Of course, that's the hope. We need the cooperation of the people for that. And the worry is that when we get to the edge, we will find more and more, these will be the people that maybe are not getting vaccinated because of different beliefs or worries. But this is definitely the direction that we are going on. And there's also different thoughts of making different, there will be some kind of green pass that people that will have the that will be fully vaccinated will have, and we're hoping that that will also encourage the people that are not vaccinated yet to go get vaccinated in order to be able to go to the swimming pools or hotels or like different things that will be open only for people that were vaccinated. But that's yet to be completely...
What you just said, and you're saying a lot of interesting things that are giving me many ideas. Does that mean there are people, because here in Ghana, there are people who are refusing to even use the masks and other things, and there are some who feel the vaccine might have contain certain elements that are dangerous for us Africans. Is that to suggest that in Israel too there are some people who need more convincing, who are not ready to take the vaccine and all of that? Are there people like that?
Of course there are, yes. I'm happy to say that it's relatively a small number in the population, and thus we see this very high numbers of vaccinating, and it's also like a lot of things. There is an element of peer pressure in it. But again, the country is trying to do whatever they can to encourage people that this is safe, which we believe it is, and scientifically I can tell you I was reading a lot about this vaccination recently, out of interest, and it seems that it really went through all of the procedures, and it's actually safer than most vaccinations that we usually use. So I don't see any reason to worry, and especially there's always a risk of something that is unknown, but since the risk that we know of is so big, it's, for me at least, it's a no-brainer that the risk that we know is higher than the risk that we are not sure of, especially now that it was already tried on so many people, and we really see very, very limited side effects so far.
Let's talk about diplomats, the foreign mission in Israel. As you're vaccinating, you've been generous enough to target them. What has that process been like thus far? Those in the Ghanaian mission in Israel, for example, have they got their vaccinations yet? Have they got their shots?
Yes, so Israel made a decision to vaccinate and take responsibility on all human beings on their lands. It includes diplomatic corps, which were all about 1,400 diplomats in Israel, foreign diplomats, were already vaccinated, including the Ghana mission, which were all vaccinated and feeling well. We are also vaccinating any residents that are not citizens, illegal residents too, from this understanding that also from the healthcare perspective of Israel, and also as a responsibility on humanitarian things to do. So I could say that even our diplomats, so me and my team here, Israel has now started a campaign to vaccinate us, and we were actually, since the agreement that Pfizer has with Israel enables her to ship the vaccinations out of Israel. We were actually flown. Israel got a special airplane to fly us, and we flew last week to Israel only to get the vaccination, stay 8 hours in the airport, and come back. So that's how much I believe in this vaccination. I spent 2 days of my life to go get it and come back.
Wow, within 2 days. So you were flown directly to Israel, and then you got your shot, and then you came back.
We didn't even leave the airport since like I mentioned, the borders are closed. So if you enter Israel now, it's very, very hard, and if you enter, you need to stay quarantined for 14 days. So we just did the vaccinations and came back.
The perks of the job.
Yeah.
Okay. So the Israeli vaccine, which is being developed because you have your own vaccine that you're working on, there are some interesting dynamics that your scientists have put forward. One of them being that it would be pretty suitable for a climate like here, what we have in tropical Africa, because it's going to be able to be stored at ordinary fridge temperatures, which we don't have with some of the other vaccines, which makes it complicated to deal with, together with other benefits. What can you tell us about the Israeli vaccine and so far what we can latch onto? Maybe some hope right
so there. As a biologist, I can tell you that from my previous work, that that the process of developing a vaccine or a drug is a very long and largely confidential process. So there's not much that I can reveal, but I can say that yes, it is supposed to be is easily stored, and also only one shot will be needed, so it will be much easier and cheaper to deploy in developing countries, or honestly anywhere. The vaccine has already finished its first clinical phase successfully with very little side effects. It is now overgoing its second clinical trial in 8 different medical centers in Israel, and the conversation about the third clinical and the final clinical trials, where and when they will take place, is now under discussion. So we definitely are very hopeful that this work will be fruitful and will be able to support not only the Israelis, but also our allies around the world. But again, this is a little bit early to already, there's still work that needs to be done. So we are mostly just crossing our fingers. I will say that I will maybe add that a vaccination is developed by the Israeli Biological Institute, which is an institute which is part under the Ministry of Defense of Israel. So it's actually a government effort, and in that sense, it will be easier to then give out or share with other countries.
So what are the timelines we're looking at? Here in Ghana, we're looking at around June to get quite a bit of a consignment of the vaccines that we're getting from COVAX, AstraZeneca, and all of that. But I know you're looking at July. Is that a...
Yes, so again, this vaccination needs to be FDA approved, and this is not in our hands. And again, the research is still undergoing, so I can't say anything certain, but we can say that our end goal is to try to make it to July. But again, it's science, so a lot is unknown and a lot can happen.
You've shared thoughts, as the mission here, that you would be willing to aid other countries, ally countries like Ghana, for example, when it comes to vaccines, when it comes to other matters. What exactly is the plan? Because now, when you're done with vaccinating your entire population, or at least most of it, what next? What happens to the vaccines, for example, that Israel develops? Should Ghana be looking forward to getting some of them?
So first of all, I will say that Israel is part of the COVAX initiative and actually donated 2 million vaccines to that initiative, which is supposed to support vaccinations in developing countries. And in that sense, we are fully aware and feel responsibility to support and see how the vaccination can get any person around the world. I think that it's also not only our responsibility as developed country, but also this is a world pandemic, and that's the way it should be looked at, and Israel is definitely looking at it that way. Again, as for the vaccination, let's wait and see, but that's definitely, since the population in Israel, again, will be vaccinated very soon, fully vaccinated, probably even before the vaccination will be finished. This is definitely a part of the plan, is to see how we can help the world in its fight, and Ghana, of course, as one of our friends, in its fight with this horrible pandemic.
Right, so friendly countries, allies, and all of that. So just to get that figure, so in terms of the COVAX program, which Ghana is also under, Israel contributed 2 million of those vaccines, the vials.
Yes. Right. I mean, these are not the developing one, but real vaccines that are already available in the market, not theoretical ones. I will add that there's also a very interesting development of a medicine for corona that has just been actually completed its first trial with very, very encouraging outcomes. It's a medicine that was developed in the Ichilov hospital in Tel Aviv, where they took 30 patients that were admitted this special treatment, and 29 of them were released. And these were severe cases of COVID that were dealt in the hospital. 29 of them were released after a few days, and also the last one also was released. It just took a little bit more time, and these are very encouraging new results that are also coming out, and that we are very hopeful will be able to help in this fight for better.
Would Israel be willing, because you make mention of helping all other countries, would Israel be willing to aid countries that may not necessarily be friendly, countries like Palestine? And the reason I bring that up is that recently in the news we've heard of some activists claiming that Israel is blocking vaccines to Palestine. What would be the position of Israel on that? Would you allow vaccines to get to the Palestinians?
Allow, of course. And again, these are, for now, I think that we are first focusing on vaccinating ourselves, which is, I think, legitimate. Obviously. And every country is doing the same. But we definitely see ourselves responsible for the world effort. And again, I mentioned this is a global pandemic, and if we will not be fighting it together, we will not succeed, because even if we will get it, say Israel will not have corona anymore, very quickly it will be coming back with a different mutation. So this is a world effort, and Israel is completely aware. And more than that, I can say that Israel views itself as a test lab for the world. And we see that now with the vaccinations, but not only, different, and I mentioned that special treatments that are coming out of Israel, but also with the various technologies to manage, to foresee the pandemic, to sterilize, and many other innovations that are coming out in order to help us live with and also get rid of the COVID. So we are definitely there.
Okay, so you will not block, but should you have excess vaccines, would you be willing to pass them on to the Palestinians?
That's of course not for me to answer. I'm here in the diplomatic mission in Ghana. That's something that you would need to ask other people.
Looking at all the strides you've made in Israel, in terms of science, in terms of technology, in terms of fighting the coronavirus, now you're one of those countries up there in terms of dealing with the virus. What do you think a country like Ghana can learn from all these strides you've made? Because the sort of impact you've made when it comes to fighting the coronavirus is not a mistake. It's because you've built your science, your technology, and all of that. What can we learn? What can the rest of the world learn from Israel now?
So I will start with maybe, it seems like the basics, and we are told it all the time from everyone, and I can tell you that as an Israelis, it's also not very easy for us to follow instructions. We like to be innovative and break out of the norms, but here a lot of it is just really keeping the rules. Washing your hands, wearing your masks, social distancing is key, and so on. So a lot of it is just a lot of self-control, which is not easy. But this is really what is needed. But if I want to take it to the next level, I think the digitalization of the health system as a very, very strong partner in the fight against the COVID. And I can give a few examples if you want for how this can meet, how this is dealt in Israel and how that can meet the world. So it starts from the patient care. So I mentioned to you before, I was in Israel for a while last year. I gave birth, and when I had to go see the doctor, or I needed some medicine or medical care, it is almost all available now online. So I could video call my doctor, get a diagnosis. The doctor would write the medicine for me. That would be sent directly to the pharmacy, and when I call the pharmacy, they already have the prescription. They can assign it to me and deliver it to my home. My risk or my exposure to the medical institutes was very, very limited. I did need to come, however, for the birth. I had to go to the hospital. That was not done via telemedicine. So that's like, in that sense, I think digitizing the healthcare is very, very important. But also on the level of managing the pandemic. So this is a pandemic that is a 2021 pandemic, and in many ways it is managed still like pandemics we managed 20 or 30 years ago, and this is something that should change and is different in Israel. So for example, in Israel we mapped the entire country to the district level and to the neighborhood level, and we can tell at every given moment how many cases of COVID are in each place. And all of Israel is, they gave it like a color coding, so it goes from green to red. And then green being safe, COVID safe, and red is a certain threshold of cases. And then when you deploy different policies, you don't need to do it just all or none. You can decide, for example, last few days ago, Israel decided to open its schools, which were closed for a few weeks. But they decided to open it only in neighborhoods that are green or orange, and remain the schools closed in the high-risk places where we see that the pandemic is now going
green
up.
or orange would be low risk
Exactly.
areas.
So being able to manage the pandemic this way really helps manage the risk, but interfere as less as possible with people's routines and with the economy's growth. We now have also different technologies that are coming up that are able to predict ahead of time using one specifically using smart thermometers. So they measure just periodically, you know how when you go into the mall they measure your temperature, you go into the school or whatever. They're able to take that data and predict up to 6 days ahead of time where there is going to be outbreak, and then make prevention measures. We also have different systems that can do a track someone that was already diagnosed with the virus. You can track his last day, his movement through his phone, and then send SMSs to people that were in close interaction with him and ask them to be quarantined. So different technologies like that are
kind of like the UK tracker app as well, right? So you know about the persons that someone who maybe is suspected of having COVID or has had COVID has been in contact with, and all of that, and then those people can immediately, on their phones or other gadgets be told.
Exactly. So my friend could just one evening, my friend got a message that you were exposed to someone that had COVID. It was in the supermarket. She didn't even know. She would never know that she was. Yeah. But since she got this message, she had to be quarantined for 14 days. And that saved her from being now also keeping on transmitting. So this is like stopping the chain. And again, there's other technologies from that sort. And of course, it goes also to the level of different sanitizing methods, different materials for hospitals and so on. And also in the medical device sector, we have quite a few interesting technologies that are now deployed in hospitals in Israel and also around the world. So all of these technologies together, I think, aside of course with the vaccination and the cure that we are most hopeful for, will at least enable us to manage this COVID, which is apparently here to stay for quite a while, and help it, help us live next to it as normally as possible. And I think that's another very big thing that's coming out of Israel, and we are of course here to help promote it and bring it to Ghana and to West Africa.
Right. So to cap off the entire conversation, what would be the expectation of Israel? We're in 2021, February, the entirety of the year. I mean, barring all things being equal, the expectation of an Israeli vaccine. And I know there's also some medication being worked on and all of that. What would be the expectation of Israel in terms of the coronavirus for the year 2021?
I think if there's one thing that COVID taught me personally, is not to make predictions and to plan very, very carefully.
It's very unpredictable, isn't it?
But what I can say is that I believe that the information and the technology and all of this good work that is being done in Israel now has the ability and could and should affect every citizen and people also, if it could be a wholesaler in Kumasi or a head of a bank branch in Ghana, in Accra, or throughout the world. And I think that I am hopeful that we will be able to see these fruits of innovation affecting us for the best very soon. I will also add that in April, we will have an annual Made in Israel conference, which we have every year. Last year we had an excellent delegation coming, 2 years ago, we had an excellent delegation coming from Ghana to Israel. This year it's of course digital, but it is a super exciting and interesting platform with over 90 Israeli companies that will be presenting. And I really hope that we will see a good representative of professionals from Ghana that will come and join us digitally and learn about these technologies and others that can come and help the healthcare here get better too.
Right. What can I say but thank you to you, Ayeli. That was just a joke. Ayelet Levin Karp, thank you so much for hosting us.
Thank you.
And Ayelet is head of the Trade and Economic Mission right here at the Embassy of Israel in Ghana. She also happens to be a biologist, something that maybe she'll be running back to at some point in time again. But we're very grateful for your time.
Thank you.
And wish you the best of the day.
You